Republican state lawmaker wants to make medical marijuana more affordable by lowering fees on the medical marijuana cards. The idea is getting some pushback. Derek Stahl reports.
How you doing today, sir?
Just to get through the door at an Arizona dispensary, you have to pay as much as $150 for a doctor's referral, plus $150 for a state-issued patient card. And you have to pay both every year.
It's a tremendous expense for a lot of families, particularly when you're talking about an expense that allows them access to medicine. It's unheard of in anywhere else.
SB 1138 would lower the costs by making the initial $150 application good for the first 2 years. After that, cards would have to be renewed annually, but for just $50 a year. Republican State Senator Sonny Borelli is the sponsor.
What I'm trying to do is cut some red tape and make it easier on our admin people, because the Department of Health is overwhelmed and they have just a short deadline to get a card out.
Critics worry that lower costs will entice less serious patients to seek out cards for recreation and could indirectly lead to more underage use.
About 25% of kids who use are getting their marijuana from someone with a medical marijuana card. What we all ought to be doing is figuring out strategies to educate our kids and prevent marijuana use.
Card and dispensary fees generate more than $14 million a year for the state, but the Medical Marijuana Act restricts how that money can be spent.
The state can't legally spend all of the money that it is collecting.
Harvest CEO Steve White says if card costs don't drop, the state will continue to build an unspendable surplus, one that already sits at $55 million.